acidity, microbiome, gut health, bloating, constipation, and much more. We're going to talk about all of this with Dr. Neeraj Rayate, so stay tuned. Hello and welcome to Breathe India. This is a show where we talk about mind, nutrition, movement. I'm Rita Date, your host. I'm a yoga and meditation coach, nutritionist, and I've authored 2 books on healthy eating. So if you want to cut through all the wellness clutter and get practical information, all backed by science, you've come to the right place. So welcome, Dr. Rayate. I'm so happy to have you here, and this is a very important topic of the day. Why don't you explain to us a little bit about gastroenterology and what it entails?
Great. So, if we have to simplify it, basically healthcare or medicine per se is divided into 2 broad streams. One is a stream which treats all the healthcare problems with medications. So, if it's a gastroenterology treating with medications, it's called as medical gastroenterology.
Okay.
And then the other stream does it with surgeries, the way we do it.
Right.
The other stream is called as surgical gastroenterology. So if you see from top to bottom, we have, say, pulmonologist who treats lung related problems with medicines. Then we have a thoracic surgeon who does and treat the heart and lung related problems with surgery. We have a gastroenterologist. When we have a gastrointestinal surgeon. We have a nephrologist who treats kidney problems with medicines, and then we have a urologist who treats kidney problems with surgery.
Okay.
So I am a gastrointestinal surgeon, but there is always an overlay between 2 specialties. So we do tend to have patients who cross from surgical specialty to medical specialty and from medical specialty to surgical specialty.
Okay, that's a good way of putting it. So what are the main digestive issues that you see today in your practice?
That's a very pertinent question. I see a lot of digestive issues. But what we see these days, which is more pronounced, is that lot of digestive issues have become now psychosomatic. So when we say psychosomatic, we mean to say that somatic is anything related to body and psycho means anything related to mind.
Right.
So good amount of gut issues these days we feel are also somewhere linked to stress. So we see a lot of patients coming to us with complaints of acidity. We see a lot of patients coming to us with complaints of hyper irritability of their bowels. We see a lot of patients coming to us with disturbed sleep and weight gain and increased appetite. And we realize that these issues are not only per se related to gut, but as a whole related to the body. And that's how the new hypothesis which has been put forth these days is that there is an additional organ now in our body which is gut, and it has a significant role to play when it comes to the harmony of our system.
So if you're saying it's related to the psychosomatic part of our brain or the issue, but as doctors you don't treat that, right? I mean, mostly it's, if you know that, then how do you go about it?
I would like to counter this a little bit.
Okay.
Stating that in healthcare, acute crises are always managed with allopathy. But I am a strong believer of alternative medicine. And I firmly believe that when it comes to chronic illnesses, there is a significant role of alternative medicine. There is a significant role of mind. There is a significant role of mind and body correlation. And I'm stating this on this platform very truly, and this is my personal experience also, that I have realized that when I was working in cancer, I saw that those patients of similar stage coming to us with a positive mindset, while those patients of the same stage coming to us with a negative mind state. Those who had negative mind state had recurrence of disease earlier and had complications also earlier. And I always remember one quote by my father, who used to say that it is never an allopathy, never an homeopathy, but an empathy.
Oh,
which
that's so nice.
cures the patient significantly. So we should not be very strict about any particular pathy, and we should be, I feel, open to everything which heals our patient. I'm not saying cure, which heals our patient internally and totally.
This is such a refreshing take on it. I love that empathy, not allopathy, not. That's beautiful. But is it hard to practice in your practice? I mean, you're very busy, and every hospital is like, they're just bursting at the seams. Doctors are busy. I mean, there's so many patients you have to see. How do you handle that?
I think, frankly, as an allopathic practitioners, we will have to understand that we have a very limited role when we treat a lot of chronic diseases as a whole. We have to understand our limitations. We have to understand that as an allopathic doctor or as a surgeon, I can't treat everything and anybody and everybody. So we used to say jokingly in our 3 years curriculum of medicine, nutrition used to be 10 years short note, 10 marks short note. So if it comes to nutrition, I will have to involve somebody who is an expert in nutrition.
Right.
If it comes to rehabilitation, I have to involve somebody who is expert in rehabilitation. And trust me, when we are treating our patients who are related to obesity, with the help of bariatric surgery, it's not the surgeon who plays a pivotal role. We have a psychologist and a nutritionist who play a pivotal role, and we always rely on them wholeheartedly for excellent outcomes. So yes, we have a role when it comes to crisis management, but it's always a team which will be playing an equally important role in excellent recovery of a patient.
Yeah, I've seen that. That is a good thing. There are nutritionists on board in the hospital, and they do make rounds, and because people aren't aware, it plays a big role.
At the same time, I think as a patients, we will have to change our mindset. These days, when patients comes to us, they always have an expectation that they want to treat every problem with prescription. So I have to ask my patients many times, why have you come to me? You have come to me for a solution, or you want a prescription for me?
Yeah.
Because many times a lot of those problems don't get resolved with prescription. But these days patients also don't have patience, and they want instant results. They don't want to spare time for their health. They don't want to focus on preventive aspects of health. And I'm quoting it here, and I think the real need is of people like you, who are working on holistic health, who are working on preventive health. I always used to say jokingly, my mother taught us preventive medicine and my father was a physician. So preventive medicine comes first before the therapeutic medicine.
Yeah, I agree. It's true. The onus is not just on the doctors. We also have to take charge of our health. We have to know that there is no quick fix. Things take time, and consistency, all of that is important.
Also, allopathy is not the last answer.
Yeah.
Allopathy is not the magic pill. Every pathy has its own limitations. We have to use each pathy judiciously and see to it that what gives the best benefit to our patients.
So speaking of different pathys, this naturopathy and Ayurveda, let's talk about Ayurveda specifically. What do you know, Ayurveda was there 5,000 years ago. They were speaking about the gut before, it became very popular. And they have, their methodologies of the doshas and your prakriti, all that. What do you feel about that? How do you, personally,
we will have to answer this at two levels. One, me as a clinician who has got trained himself in allopathy, and probably your knowledge of Ayurveda may be much, much more than my knowledge. So when a similar question is asked to me by my patients, I tell them that I'm not an expert in Ayurveda. At the same time, I'm always open to anything which makes my patient better, makes them healthier, and we will all have to explore the ways and means by which this can happen. I definitely believe that Ayurveda has a role to play in healing of patients. How, when, where is something which is a big area of research. I have a lot of my friends who have done their Ayurveda and do practice exclusively Ayurveda. One of my friend, Dr. Nisar, is an invited faculty outside India also. And in fact, when I had fracture of my lower leg and I had a chronic pain after that, I had met him, took his guidance and consultation for healing of my pain, and it did help me. So I never deny role of any alternative medicine, but what we would probably love is an evidence to support the effectiveness of these therapies. And as an Indians, as an our history of Ayurveda, I think we should make all our efforts to prove how it works efficiently.
Yeah, luckily there are people who are doing that now. There's a few companies that are making evidence-based medicine. They're not just, just because it was there before, just manufacturing it again. They are like doing the trials on people and long-term trials. So that's a good thing that's happening.
Yeah, absolutely.
Yeah. So we know, like I said about the gut, it's like the big, the second brain. What is exactly a gut? What is a microbiome, basically? To explain to a layman, please.
See, when we are in mother's womb, our gastrointestinal system, which starts from mouth to the anal opening, has never been exposed to the different bacteria of the environment. And as the baby takes its birth, during the passage of the birth, the baby gets exposed to the different bacteria, and from that moment till we live, our body through various means gets exposed to different bacteria and their stimuli. And the balance of these bacteria, which are good for our body and bad for our body, is basically the effect of our health, is a hypothesis which is prevalent. Although scientists have not been able to completely find out which are the good bacteria as such and which are the bad bacteria as such totally, and it's a field which is in exploration as.
Okay. So what foods are good to feed this microbiome?
It's a tricky question because in today's environment, even if we choose a particular food, I don't know the source of the food. I don't know the methodology, the way the food has been procured. So I usually do not, I'm not a very fan of extreme food preferences. What I believe is anything in excess is harmful to life. So, but yes, any carbohydrate rich products or those products which are high in sugar or salt or those which are highly processed, I am not very fan of them because I believe that our gut has been meant to process food in a way that it suits our body, and when we give our body processed food, we are more vulnerable to ill health.
Yes, I agree. So people ask me also like, what food should I eat for better whatever. So, but there's no one food. There's no superfood.
Correct.
Everybody wants that answer. But you cannot just give an answer.
Correct.
It's a holistic thing. There are no superfoods. So
I think people will have to understand that there is no one answer or one solution to every problem. You can't have a particular type of food or an exercise or a lifestyle which can just solve all our problems, and it varies from individual to individuals and persons to persons. The way each one of us has a different personality, different preferences, different sizes of clothing, we will have to be very selective about what suits us and then adhere to. So I come across a lot of patients who follow extreme diets and they want to get healthy with those kind of diets, and my only answer to them is that try and do something which you would be able to follow all your life. If you can follow extreme diet all your life, then yes, I'm okay for it, but that's actually not something which I will really enjoy in my life.
Yeah, like that was one of my questions is, do you have any opinion on veganism or like paleo or this Mediterranean diet is our regular thali, but these, like, for example, veganism. Do you have any opinions?
Again, I'm not a very right or left kind of personality. I try to follow a balance of everything. So
but have you seen anything as far as gastro issues with these kind of diets?
I have seen some patients finding relief with it. Well, I have also seen some patients not getting benefited or getting adversely affected with it. So again, we will have to figure it out what suits that particular individual. There are people who definitely get benefited. If you get benefited and if you can comply with that kind of lifestyle all your life, you're most welcome.
Yeah, something sustainable.
Yes.
Intermittent fasting. I believe in that in some form, just because we're eating all the time. It's a habit that we've cultivated over the last 30 years or 40 years. We didn't do that before, and it's affecting our health. So intermittent fasting has that pro of you have to just not eat and you don't have to think too much. But some people, when I tell them, like, oh no, I get acidity, I get this, that. What is that possible? I mean, if you don't eat for an extended time, do you get acidity? I mean, a lot of famous dietitians are saying eat every 2 hours. So I just wanted your take on that.
This is a very interesting question. Per se, we will have to understand what has happened to India in say last 50 years, by which we will probably be able to understand why we have reached to where we have reached. If we see India before independence, India was forcefully fasting because there was no food which was easily accessible or available to us. Actually, if you speak the amount of calories which are required in today's India versus India which was 50 years before, the amount of strenuous work which Indians used to do is no more true. So the amount of calories required these days are much lesser compared to the India which was
we're not moving
early. When it comes to fasting, I am always for it. In fact, we all know in Indian culture and tradition, we used to have different kinds of what we call upwas in Marathi, which used to be probably to cleanse our body. Now those upwases have been modified these days with different kind of food which we eat on those days.
Yeah.
And
is this a modification? They didn't have like this sabudana khichdi before?
I don't think so.
No? Okay,
I don't
yeah,
think so.
I don't think so either.
We will have to really go and
look
find
at the
into the
history,
literature.
Yeah.
But I don't. The fasting was purely fasting.
Fasting, yes.
The fasting was probably with water, or then there used to be fasting with say white substances, food items which are white, and probably over a period of time. These things got evolved.
Got added later.
And these things, these days now, every festival has become a celebration. And this has really complicated the things. As it comes to intermittent fasting, again, I would definitely I personally follow intermittent fasting. At the same time, in my personal experience, my visceral fat has gone down significantly after intermittent fasting. I have a very strong family history of diabetes in my family. My father, my mother and my grandparents were diabetics. So I decided that I don't want to go there. So I started practicing intermittent fasting. Now I've been doing it for last 4 years and it's working pretty well for me. At the same time, then there are occasions where if some interesting food comes and I like eating, I'm not very rigid about following fasting on that particular day, intermittent fasting per se. So if you cannot, we will have to work around the way and understand what suits our body. But I can definitely say that eating continuously is not something which is definitely going to suit our body for a long. And it does have a scientific explanation about, because every stimulus of gut will lead to release of insulin and in long term can cause obesity. But the same is not true, because I see good amount of patients, people, friends who eat huge amount of food and they are still lean and thin. So there is definitely a role of genetics also which plays. And that's why I say that it is very difficult to make generalizations out of these conversations.
But those are rare, lean and thin. And even if they're lean and thin, it doesn't mean that they're healthy. I mean,
true.
Right.
True.
Yeah.
So same is true with diabetics. You will see thin, lean diabetics, you will see obese diabetics.
Right.
So we'll have to understand genetics also. And if you have to ask me frankly, the most important factor which plays a major role when it comes to our health is genetics. So we have to understand what had happened to our ancestors, what had happened to our parents, and if we have seen a particular kind of disease which had happened to them at a particular age, we have to be proactively working on it. The way I told you, my parents had diabetes.
Right.
I have seen my classmate had an myocardial infarction at the age of 40 His father also had a heart attack at the age of 40.
Okay, yes.
So
you have to pay attention to
we have to understand what is our family history and work proactively on it.
That's great that you've done that, So, yeah. Because it takes some time, but once you start it, I think all those other issues go away.
Absolutely.
Right?
Absolutely.
So, I know...
Again, mind comes here.
Yes, mind comes. You should send everyone just to come to do yoga. And so, in your practice, I know, this is a common thing people talk about. They have acidity, they have bloating. So that's a very common thing these days. And is it just an age-related thing, or do you see it happening younger and younger with people?
I think it more than age, it is related to the lifestyle. Current lifestyle of good amount of us, whether it is younger age or elderlies, lacks significant physical activity. If you see elderlies, most of them lack physical activity, and on the top of it, because of their age, they tend to defend whatever physical activity they are doing as the correct way of doing a physical activity. The same is true with younger people. They do a particular type of activity. You know the commonest national exercise of India? Walking.
Yeah.
So when we ask any patient what kind of exercise you do, and they say, yes, we do 4 kilometers walking. But I don't think that's the right way of going about it. Physical activity, again, there are experts. There are experts in yoga, there are experts in strength training, and we have to follow them and try and develop something which suits our body, and then follow it for a long.
Yeah, and just walking that 4 kilometers is just not enough. That half an hour or 1 hour. You need to be consistently moving through the day. And in our ancient wisdom, Shattapauli, very important.
True. There is a term for continuously moving, which is called as NEAT.
Okay.
It is called as non-exercise activity thermogenesis.
Oh, okay.
A different need. If we do exercise only at a particular part of day, and if we are sitting all throughout the day, then the metabolic rate again tends to go down and remains low.
Right.
But if we are following NEAT, if we are active all throughout the day, the metabolic rate tends to remain higher.
BMR goes up.
Yes,
yeah.
and it helps in the issues related to bloating. It helps in maintaining your weight. It helps in making yourself fresh.
So guys, listen to a gastroenterologist is telling you to move. So please, follow that advice. So yes, as we're, that's very important. People are just not moving.
Not at all.
Yeah. This IBS. Let's talk about IBS. Intestinal bowel movement. Irritable bowel movement. What is it, and is it real? I mean, there's no cure for it, they say. So can you explain that a little bit?
So in allopathy per se, or in our medicine, we tend to stamp a particular disease as a stress related or a psychological disease when we have ruled out all other obvious causes of illness. When it comes to irritable bowel disease for say, when there are no obvious causes of the symptoms which patient is facing, then we can stamp a particular disease as irritable bowel disease. Now medical gastroenterologists use a short term called as IBD, and that is also used for the other part of bowel disease, which is called as inflammatory bowel disease. So sometimes some
patients...
Yes,
that's what I was getting confused with.
Yes. Some patients tend to confuse with inflammatory bowel disease and irritable bowel disease. They are totally different. So inflammatory bowel disease has definite treatment which is available medically as well as surgically, and there are guidelines to treat them. Whereas irritable bowel disease has no obvious cause which is found in the whole gamut of investigations which are done for the patients, and then we work with these patients and tell them to work on their mental health, because the hypothesis is that the symptoms which the bowels are giving are probably related to some kind of stress in the life of that individual, and then we will have to work on coping up mechanisms for that stress.
Okay. Fatty liver. Can you explain why are Indians, like you said, genetics, are we just prone to that, or does everybody have a fatty liver that we don't test it for, or is it dangerous, and what should we do about that?
No, so we will have to really understand the stages of fatty liver. At the same time, we will also have to understand that a lot of fatty liver in the early stages is not harmful. Liver is an organ which stores fat. If it stores fat more than what is expected, then that can cause damage to liver, and over a period of time that can get converted into non-alcoholic steatohepatitis, which basically leads to inflammation of the liver. So, good amount of patient these days, because of accessibility and availability of ultrasound or other gamuts of investigations,
Yes, they do. They know about it more. Yeah.
they investigate and then they found to have fatty liver. Fatty liver is a consequence of the highly processed and carbohydrate rich food which we are eating. So, if we add lot of fibers in our diet, if we make our diet complex, we can definitely prevent progression of fatty liver. It's an extension of a visceral fat which can lead to diabetes. At the same time, just because our ultrasound report says that there is a fatty liver, we should not panic. We should try and understand the patient as a whole, and if the fatty liver is affecting this patient. We do have patients who are highly obese and also have fatty liver, and in these patients we have to intervene and do surgery for their weight loss. So again, fatty liver of what stage, of what extent, will be something which we will have to understand, investigate and treat accordingly.
Right. You have to see what stage it's at.
Yes.
Right. Okay. Alcohol. What is your take on alcohol?
I am personally a teetotaler, so it is difficult for me to comment about whether it is right or wrong.
As far as your digestion goes, I mean, as a doctor.
In my upbringing, it was a completely prohibited thing. So I don't know what will happen with our younger generation, whether they will have it, whether they will not.
They're having it a lot. So do you see that, and do you see people coming in with any of those?
Again, I would come to a one simple line: anything in excess is harmful to life. It is difficult to maintain moderation with alcohol, and that is a challenge. Again, alcohol is empty calories. Empty calories are going to harm us in long run. We see a good amount of patients who do very regular exercise, and at the same time there is a term which is called as beer belly.
Yes.
So they, as a part of alcohol, they have a very regular consumption of beer. So they do exercise, but they have a belly, and I don't think any individual likes a belly. So it's a choice each individual has to make. Given a choice, I will definitely not recommend it. There are a lot of good ways to indulge yourself than alcohol. It's an individual preference.
Yeah, I agree. I agree. It's an individual preference. Nobody should force you to do it. This is what's happening in the younger generation.
Correct.
It's more of a peer social circle, peer pressure, and that's a bad thing. Yeah.
Correct.
I know you said there's no specific food that that is good or bad for you, but probiotics, Indian probiotics. So we have our yogurt, and what is your take on fermented foods?
It is good. It is definitely good. If we have to really focus on one particular item, which all of us as Indians should include in our diet, I would be more inclined to proteins.
Okay.
If you see any average standard plate of any individual having food, you will see very, very less protein in their diet. So more than micronutrients, in macronutrients, I feel there is a good amount of shift which is needed for Indians. Conventional Indian diet always used to have protein in their diets. You can see pitla and bhakri, varan and bhat, khichdi, which used to be a combination of protein and carbohydrates. Yeah. These days,
even usal, our
these days the dal has gone completely out of the Indian diet, and the diet has become more and more carb rich. So if one superfood I have to recommend to all Indians, I would probably ask them to focus on proteins.
Increase their protein. Okay.
Yes. Gross intake of protein in Indians is very, very low, where the average recommendations are at least 40 to 60 grams, 1 gram per kg per body weight. And if you see our average weight around 70 kgs, we need to have 70 grams of proteins, and we hardly have that.
Yeah.
So I think
increase the dal, increase the legumes and the lentils.
each plate should focus on, and you should ask yourself, what is protein in my plate? That is something I'll definitely emphasize on.
Okay. And also, the next question is, everyone is talking about the dangers of dairy and gluten. What do you think of that? Do you find that problem in the gut?
I think we will have to understand the procurement also, because when it comes to dangers of dairy or gluten, it is somewhere related to procurement. It is somewhere related to how these food items were harvested or are harvested. I know few patients of mine who have come from Mofussil area and have told me that, sir, you don't know the way animals are given different medications to increase their production. It is been told that some non-vegetarian food like chicken or egg, also the animals are fed with different food items like alcohol to increase their weight.
Oh.
And then since we don't know the method of procurement, it is difficult for us to understand how we can trust the source of food.
Yeah, it's unfortunate. We don't know our dairy source. We don't know most chickens are filled with antibiotics and these things. So
not only chickens, even the vegetables which are grown, the farm which is grown also is fed with good amount of chemicals and fertilizers. So it is very difficult to. But then these are uncontrollable factors probably for us as an individuals.
Yeah.
What we can focus on controllable factors. There are innumerable controllable factors which we are not focusing on, and then we are focusing on uncontrollable factors is probably not appropriate way of living life.
Yes. So should we go back to eating like our ancestors? Like, and there's a new thing about millets now, and I personally believe that it's a good thing.
Absolutely.
Yeah, it's people are wary of why are we changing, but it's a good change, and we do need to go back. It has more fiber, it has more nutrients, so that is having. But this change in diet. My question is, this change in diet, does it have an effect on us? Or is it good for us?
Absolutely, I completely agree. But for that, we will have to give enough exposure, enough time.
Right.
The issue is that people want to change and they want to see the results tomorrow. They want to go to gym and they want to see their dole sholes next day, which never happens.
Right.
Anything, if we want to have some lasting or some productive or some effective impact, we will have to work on it. Even if we have to have a baby, we have to work for 9 months.
Right.
So are we at least willing to give 9 months?
The women have to work for 9 months. Okay. Yeah.
So accepting that fact, if we are not going to give at least 9 months for a particular change in our lifestyle, I don't think we should be expecting results which are of significant change.
Yes.
Or of significant impact or of significant difference.
Right. So, yeah, I agree with you. People just want things like this.
One line which I can say here is that try and follow which is cooked in your, or which is produced in your area very regularly.
Local.
And which is seasonal for your area.
Yeah.
Again, there can be some deviations for the sake of taste or for the sake of exposure. But if we remain local and seasonal, it is very simplified.
Right. And start a kitchen garden. Start growing a few vegetables even in your terrace. Colon cancer. So I know that it's on the rise, especially amongst younger people. Why is that happening, and what should we look for?
So it's not only about colon cancer.
It's all cancers. Yes.
I'm seeing a good amount of rise in cancer, but then the concern which is raised is the incidence rising. It is difficult for me to comment whether the incidence is really rising, but the thing is that we have grown technologically also. So probably we are picking up the illnesses early.
Right.
We have lot of investigative means by means of which now we have been diagnosing a lot of illnesses which were not diagnosed earlier. So it can be a perception, but yes, the incidence of cancer, gut cancer, colon cancer is rising, and it has definitely something related to our lifestyle. Again, difficult to pinpoint a particular reason. So I would rather suggest everybody to work on the preventable things or the things which are controllable in our hand than focusing on those which are non controllable.
Yeah. Like my husband actually had a lot of digestive issues, so everyone was telling him get a colonoscopy. Everyone means friends and family in the US. And so he finally went, and the doctor said, you don't have an American diet. You do not need a colonoscopy. You can do some other investigations. So when is it necessary to get a colonoscopy? Is it a preventive measure?
It can be, definitely. I am little of a mindset where I feel that if a particular investigation can give you peace of mind, go ahead and do it. There is no harm in doing a diagnostic investigation when it is possible, especially here in India. Outside India, it is not possible. In India, it is possible. So we can definitely go and get an investigation and get reassured to yourself that you are healthy. What next?
Yeah.
But then you will have to thereafter work on your health and fitness. Otherwise, don't take that you are healthy, so you don't need to do anything about your life. Then probably we are living in a mirage.
Yes. Okay. That's a good point. If you have the time and resource, not if you have the time, you have to make the time and get all these investigations done. Be proactive about your health.
I completely agree. I am a strong believer of regular screening. We have to screen ourselves for conventional investigations after the age of 40, at least once in a year. I usually recommend my patients the day next after your birthday, because I don't want to spoil anybody's birthday. But once you celebrate your birthday, next day probably book an health check appointment, get complete screening done, and treat the problems at an early stage than waiting for something surprising to happen. Does that give us 100% assurance? The answer is obviously no, because there is a window of 1 year between the two investigations, and we can have something surprising between that 1 year. But at least it can reduce the possibility of surprises and complications, if at all there are anything to happen.
Okay, so there's no particular age, like you don't have to get it at 55, you should get a colonoscopy, anything?
A colonoscopy, I would probably advise to those who either have some or other kind of symptoms related to their large bowel, where they have bleeding or altered bowel habits like diarrhea alternating with constipation, or again a strong family history.
Okay.
Now somebody who has a strong family history needs to have a very high index of suspicion about himself, and any abnormality or deviation in their day-to-day routine, they should chase the symptoms to get themselves assured that there is nothing which is happening abnormally in their body.
Okay. Same thing with gastroscopy, right?
Correct.
Similar thing.
Yes.
Okay. Are there any like lesser known but effective ways to prevent digestive issues that you can tell us?
I don't think there is anything lesser known these days. We are in the world
I know,
of
that's what I'm
information
saying.
explosion.
Every newspaper you pick up, any media outlet, every influencer is talking about how to improve your gut or something. So I wanted to hear it from a doctor.
So in my belief is less is more.
Okay.
The simpler you keep the things, the better it is. The uncomplicated you keep the things, the better it is. So practicing simple things like doing regular exercise. A lot of patients of mine ask me about what should be the diet they follow, especially after surgery. And my answer to them is just 2 words: fresh, home cooked. Probably this is true for anybody of us or everybody of us. If you have fresh food which is home cooked, good in proteins, do regular exercise, and avoid sugar, salt, I think this is more than
very
enough.
simple, but very difficult to do. I mean, for most people are going to office, they're busy, but they have to. I mean, this is the new way of living that should never have been changed, but due to work situations and the fast-paced culture. But now we have to just go back, take a step back, and go back. So for people who have like minor issues, maybe they're not minor, like bloating or constipation, when do they need to come see a gastroenterologist? When do you suggest? What are the red flags that they should?
If they are trying to self-treat their issues for at least 2 weeks time, and if they don't find relief with their issues, might as well they consult a doctor.
Okay.
And get themselves assured that those issues which they are facing are not something of concern. Once you have that assurance, that will probably, because a lot of issues can be psychosomatic, those issues can lead to stress, or probably somebody can tell us that the issues which you are facing are less of your body and more of your stress. That can also help.
Okay. And what advances in your field excite you?
This is a very interesting question. We are living in a era where we have to get ourselves updated almost a year or couple of years, and it is really fun to do that. In the field of surgery, the day I was trained, in the era when I was trained, people used to say big surgeons take big incisions. So most of the surgeries those days used to be done by big cut over the belly or a part of the abdomen. These days almost all surgeries are done by minimal access. The newer advances of minimal access also has come, which is robotic surgery. So we do almost every surgery these days by means of either laparoscopy or robotics, and it is rewarding to the patients. In the era where patients want to get back to their life and their routine fast, these surgeries where patient used to lose at least 6 weeks of their life in the recovery, they recover in a week's or 2 weeks time, which is very good. And in fact, the field in which I am working, obesity, is coming up big time with lot of newer things which are coming, and those would definitely help. It's a call which all of us will have to take. You want to go that way or you want to prevent and work on living a healthy life.
Well, speaking of that, we're going to have a part 2 with the Dr. Rayate, all about obesity and bariatric surgery, which is one of his specialties. So stay tuned for that episode. In the meantime, where can people find you? By the way, he has a wonderful YouTube channel. He speaks very eloquently. It's in Marathi, and it's a treat to listen to. So where can they find you?
If they search my name, I share my mobile number with every patient. I like to be friend with everybody. I am accessible to everybody. My phone is on 24/7. Luckily, by God's grace, I am still not that much busy that I cannot answer people's call. And I tell them that if I don't answer your call, I am operating. Leave a WhatsApp message and I'll get back to you once I get free. And I'm happy to remain connected, because I feel that all of us are responsible citizens these days, and we won't call a doctor just like that. If we are really calling them, we have a concern, and I would love to help if anybody needs it.
Wow, that's refreshing. Well, thank you so much. For this, everything you've said has been very valuable. This is Dr. Neeraj Rayate. He can be found at Jupiter Hospital here in Pune, and it's drneerajrayate.com. You can look him up, and there's a lot of information on that as well. So thank you, and stay tuned for the next episode.
Pleasure is mine.
Yes.